Will hair grow back after stopping testosterone therapy? Partial hair regrowth may occur after stopping testosterone if follicles remain viable. Where regrowth does happen, visible improvement can take 12-24 months or longer, and complete restoration is uncommon. Is hair loss from testosterone therapy permanent? And can anything be done about it? Those are great questions. And the honest answer is it depends. Let me explain what the research tells us. If you're on testosterone therapy, whether for hormone replacement or gender-affirming care, it's worth understanding how it can affect your hair and what your options might be if you notice changes. Testosterone doesn't directly cause hair loss. What happens is that your body converts testosterone into another hormone called dihydrotestosterone, or DHT. This conversion happens through an enzyme called 5-alpha reductase. DHT is a much more potent androgen, and in people who are genetically susceptible, it can attach to hair follicles on the scalp and gradually shrink them, a process called miniaturization. Over time, this shortens the active growing phase of the hair cycle and extends the resting phase. The result is that hairs become finer and shorter, and eventually some follicles stop producing hair altogether. This is androgenetic alopecia, commonly known as male pattern baldness, and it typically affects the frontal hairline and crown first. Now, here's something worth knowing. Testosterone therapy can actually stimulate hair growth in other areas, the face, chest, abdomen, and limbs. That's because follicles in those regions respond to DHT differently, so the same hormone can promote hair in one place while contributing to loss in another. How much scalp hair loss you experience depends on several factors. Your genetic predisposition matters most. If there's a family history of male pattern baldness, your risk is higher. Treatment duration, dosage, and your baseline androgen levels also play a role. Some people notice thinning within months of starting testosterone. For others, significant changes may not appear for years. Research also suggests that keeping testosterone within the target physiological range may reduce the risk of hair loss compared with higher levels. So, will hair grow back if you stop testosterone therapy? Possibly, but it's not guaranteed, and complete restoration is uncommon. The key factor is whether your follicles are still viable. If miniaturization hasn't progressed too far, there's a chance of partial regrowth, though this typically takes 12-24 months or longer. Once follicles have been significantly miniaturized over a prolonged period, the potential for regrowth diminishes considerably. It's also really important to say, stopping testosterone therapy isn't a decision to make on your own. It can have significant physiological and psychological consequences, so any changes to your treatment should always be discussed with your prescribing clinician first. If you're concerned about hair loss, there are evidence-based treatment options worth discussing with your doctor. Topical minoxidil is one option, applied directly to the scalp. Oral finasteride is another, and it works by blocking the conversion of testosterone to DHT. However, finasteride does carry risks that are important to be aware of, including the possibility of persistent sexual dysfunction and psychiatric effects. Your doctor can help you weigh up whether either of these is appropriate for your situation. It's also worth documenting your hair and scalp condition before starting testosterone therapy, so you have a baseline to compare against if changes occur later. In terms of when to seek medical advice, don't wait if you're noticing rapid or significant hair loss, any scalp symptoms like itching, scaling, or soreness, or if hair changes are causing you psychological distress. Early intervention tends to lead to better outcomes, so it's always worth raising concerns, sooner rather than later. Your GP or a dermatologist can help assess what's happening and discuss your options. So to recap, testosterone therapy can contribute to scalp hair loss through DHT, particularly in those with a genetic predisposition. Whether hair regrows after stopping treatment depends on the degree of follicular damage. Partial recovery is possible, but complete restoration is uncommon. And there are treatments available that your doctor can discuss with you. Please speak to your GP, prescribing clinician, pharmacist, or dermatologist for advice specific to your situation. Nothing in this video is a substitute for personalized medical guidance. If you found this helpful, leave a comment below. We'd love to hear your questions. And if you'd like more videos like this, give us a like and subscribe to the Bolt Pharmacy channel.